Imagine your body's immune system as a highly specialized team, fighting off illness and keeping you healthy. Sometimes, this team needs a complete reset, especially when dealing with certain cancers like lymphoma. That is where stem cell transplants come in, offering a profound way to rebuild your body's blood-forming factory. But not all transplants are the same, and understanding the differences can make a big impact. When comparing autologous and allogeneic stem cell transplants for conditions like lymphoma, the main difference lies in the source of the healthy stem cells. An autologous transplant uses your very own stem cells, which are collected before high-dose treatment and then returned to you. In contrast, an allogeneic transplant uses stem cells from a donor, who is often a family member or an unrelated volunteer with a genetic match. The core reason for choosing one over the other centers on disease risk and immune system interaction. An autologous transplant offers the benefit of using your own cells, which means no risk of your body rejecting the new cells or the new cells attacking your body. This makes the recovery generally smoother and faster. However, because your own cells are used, there is a small chance that undetected cancer cells could also be collected with the stem cells. An allogeneic transplant introduces a new, healthy immune system that can powerfully fight any remaining cancer cells, a benefit known as the graft versus lymphoma effect. This is a potent advantage, but it also carries higher risks like graft versus host disease, where the donor cells attack your healthy tissues, and a greater chance of infection. To help decide which type might be right, you will need to discuss several key factors with your care team. Consider your specific lymphoma type and its characteristics, your overall health and age, and the availability of a suitable donor for an allogeneic transplant. Your doctors will also evaluate the intensity of the pre-transplant chemotherapy and radiation, which varies between the two approaches, and what potential side effects you might be better equipped to handle. A fascinating aspect of allogeneic transplants is the concept of chimerism, where your body essentially becomes a blend of your own cells and the donor's cells, particularly within the blood and immune system. This biological integration highlights the profound change an allogeneic transplant brings. Another important distinction is how each type handles residual disease. Autologous relies on the high-dose therapy alone to eradicate cancer, while allogeneic adds the powerful anti-cancer effect from the donor's new immune system, a phenomenon that continues to be a focus of advanced research. Ultimately, both autologous and allogeneic stem cell transplants offer powerful opportunities to combat challenging diseases, each with unique strengths and considerations. By understanding these differences and discussing them openly with your medical team, you can gain clarity and confidence in navigating the path that offers the best chance for a healthy future, tailored precisely to your individual needs and circumstances.